Hey there, health-conscious viewers! Today, we're diving into a crucial topic that affects millions of people: colon cancer. Have you ever wondered what the early warning signs of colon cancer are? Well, you've come to the right place. In this video, we'll walk you through the top 10 early warning signs that you must be aware of to stay on top of your health game. But before we delve into the details, I'd like to ask for a small favor. If you find this information valuable, please show your support by hitting that like button and subscribing to our channel. Your support helps us keep producing informative videos just like this one. Now let's get started. Colon cancer, the fourth leading cause of cancer-related deaths in the United States, demands our attention. With over 100,000 new cases reported each year and affecting approximately 1 in 25 adults, it's a disease that can have a significant impact on individuals and their families. The concerning part is that most colon cancer cases remain asymptomatic until the disease has already advanced to other parts of the body. However, awareness of the early warning signs can be the key to prompt detection and better treatment outcomes, which is precisely the topic we're delving into this video. Blood in your stool is one of the most common early warning signs of colon cancer. If you happen to notice bright red blood in your poop, it could be an indication of bleeding in the lower intestinal tract or rectum. It's essential not to panic immediately, as this symptom can also be caused by less serious conditions like hemorrhoids or anal fissures. However, it's crucial to consult with a healthcare professional to rule out any significant underlying causes and address the issue appropriately. Additionally, you may observe maroon or darker colored bowel movements, which might suggest bleeding higher up in the gastrointestinal tract. Paying attention to these signs and seeking medical advice can be critical to catching colon cancer in its early stages. Another red flag to be aware of is changes in bowel habits. If you notice persistent alterations in your bowel movements, such as constipation, diarrhea, changes in frequency, incomplete bowel movements, or decreased stool thickness, it could be an early indicator of colon cancer. While these changes can sometimes result from dietary shifts, consumption of disagreeable foods, or bacterial and viral infections, it's crucial not to dismiss them if they persist for an extended period. Consulting with a healthcare professional can help determine the underlying cause and address any potential issues timely. Next on the list is anemia. Anemia occurs when there is a deficiency of healthy red blood cells or hemoglobin, which are responsible for carrying oxygen to the body's tissues. In the case of colon cancer, you might experience anemia even without noticeable rectal or stool bleeding. Intestinal bleeding might occur without any overt signs, leading to symptoms like fatigue, shortness of breath, or lightheadedness. You should find yourself experiencing any of these symptoms. Seeking medical attention and further testing is of utmost importance to ensure prompt diagnosis and appropriate management. Loss of appetite is another symptom that individuals should be vigilant about. Cancer cells can produce substances that disrupt the body's food processing, leading to a decrease in appetite. Consequently, weight loss might occur as a consequence. Additionally, other medical conditions such as gastrointestinal disorders or certain medications could also contribute to a diminished desire for food. Proper nutrition is essential for overall health, and a loss of appetite can quickly lead to malnutrition, negatively impacting one's well-being. Therefore, if you find yourself experiencing a noticeable loss of appetite, it's vital to discuss this with a healthcare professional to identify any underlying causes and address the issue accordingly. Your healthcare provider can help determine the best course of action, which may involve managing any medical conditions, adjusting medications, or recommending dietary changes to ensure you maintain a healthy and balanced diet. Unexplained weight loss can be a significant cause for concern and is often associated with multiple types of cancer, including colon cancer. If you notice a drop in weight without any intentional efforts to lose it, especially when accompanied by other symptoms like loss of appetite, it's crucial to seek medical advice promptly. Unexplained weight loss might be a result of various factors, including persistent diarrhea or difficulty in digesting and absorbing nutrients, which can be related to colon cancer or other medical conditions. Early detection and intervention can significantly impact treatment success and overall outcomes. Nausea and vomiting might also come into play as potential early warning signs of colon cancer. cancer cells can disrupt the body's normal food processing mechanisms, leading to symptoms like persistent nausea and vomiting. Additionally, a tumor in the rectum can obstruct the intestines, leading to a buildup of waste and toxins in the body, contributing to these unwanted symptoms. Therefore, if you find yourself experiencing persistent nausea and vomiting, coupled with other signs and symptoms, it's crucial to consult a healthcare professional to explore potential causes and take appropriate action. Now, let's talk about diarrhea. Defined as loose, watery stools occurring more than 3 times per day, diarrhea is a common symptom that can arise from various conditions, such as food poisoning or stomach virus. However, it can also be an early warning sign of colon cancer, especially when accompanied by other symptoms mentioned in this list. While experiencing diarrhea itself is not necessarily a cause for immediate concern, prolonged or severe instances should prompt you to seek medical attention for further evaluation and diagnosis. Abdominal pain is a symptom familiar to many for various reasons. However, it can also be an early indicator of colon cancer. As mentioned earlier, cancerous tumors growing in the colon can lead to obstructions in the intestines, resulting in the accumulation of gas and waste, leading to discomfort. Abdominal pain might present as cramps, bloating, or distension. While not all abdominal pain is indicative of colon cancer, severe or persistent pain should not be ignored and warrants medical evaluation to ascertain the underlying cause and receive appropriate care. Next on the list is chronic fatigue, which deserves special attention. Chronic fatigue is a common symptom observed in multiple types of cancer, including colon cancer. Studies have shown that fatigue is experienced by approximately 80% of patients with colorectal cancer, and around 30% of these patients report experiencing chronic fatigue. This persistent tiredness can significantly impact one's quality of life and daily activities. Additionally, colon cancer's effects, such as malnutrition and weight loss, can contribute to fatigue, making it a crucial symptom to recognize and address with medical professionals. And lastly, pelvic pain is worth discussing, though not explicitly an early warning sign of colon cancer. If pain occurs in the pelvic region, it may indicate that cancerous cells have spread from the intestines to this area. While more research is needed to establish the exact link between colon cancer and pelvic pain, a population-based study has shown a clear association between the two. It's especially crucial to be aware of this symptom if you have a history of intestinal issues. If you experience pelvic pain, it's vital to seek immediate medical attention for further evaluation and appropriate management. Understanding the early warning signs of colon cancer is essential, as early detection can lead to more successful treatment options and improve overall prognosis. To recap, these warning signs include blood in your stool, changes in bowel habits, anemia, loss of appetite, unexplained weight loss, nausea and vomiting, diarrhea, abdominal pain, chronic fatigue, and pelvic pain. If you experience any of these symptoms, it's crucial to make an appointment with your healthcare provider to get checked out. Remember, catching it early gives you a better chance of beating it. Have you or someone you know ever experienced any of these early warning signs? If so, were you aware at the time that they could be potential indicators of colon cancer? Share your thoughts and experiences in the comments below. Let's keep this conversation going. And remember, if you enjoyed this journey and want to continue learning about optimizing your health and well-being, don't forget to hit that like button and subscribe to our channel. Stay curious, stay inspired, and always remember that your well-being is the ultimate treasure. Here's to a life filled with vitality and abundant health.